In the 9th century, a Benedictine monk in southern Germany wrote something in his medical journal that stopped researchers cold when they found it 100 years later. He described a condition he called melancholia of the spirit. Racing thoughts that wouldn't stop. An overwhelming sense of dread without cause. Inability to sleep. Trembling of the hands. We would call it anxiety disorder. He called it a spiritual affliction. But then he wrote something remarkable, a remedy. A specific herb, prepared in a specific way, taken at a specific time. And he recorded the outcome. Within 3 days, the trembling stopped. Within a week, sleep returned. Within a month, the melancholia had lifted. The herb he prescribed was lemon balm, Melissa officinalis, a plant so common it grows as a weed in most of Europe. In 2024, a randomized controlled trial published in the journal Nutrients confirmed what that monk recorded 11 centuries ago. Lemon balm significantly reduces anxiety symptoms, improves sleep quality, and reduces cortisol levels, the body's primary stress hormone. 11 centuries. One herb. And science finally caught up. This is what we do on ancient remedies. Let's go. Lemon balm has one of the longest documented medicinal histories of any plant in Europe. We're talking about continuous recorded use, stretching back over 1,000 years, from 9th century Benedictine monasteries all the way through to the apothecary shops of 17th century London. The name Melissa comes from the Greek word for honeybee. Medieval herbalists noticed that bees were powerfully attracted to the plant, a sign, in their symbolic framework, that the plant contained something vital and healing. Hildegard of Bingen, the 12th century abbess, healer, and arguably the most sophisticated medical mind in medieval Europe, wrote about lemon balm extensively. She prescribed it for what she called heart sorrow, a condition combining grief, anxiety, and what we might today call depression. Her prescription, lemon balm steeped in wine, taken in the evening. The 16th century Swiss physician Paracelsus called lemon balm the elixir of life. He claimed it could completely revivify a man, which sounds like hyperbole until you understand what he was observing. Patients with severe nervous complaints, tremors, insomnia, panic responding consistently to a preparation he could reliably reproduce. By the 17th century, Carmelite water, a preparation made primarily from lemon balm, was sold across Europe as a treatment for nervous disorders and headaches. It was one of the most widely distributed medicinal preparations on the continent. Not a fringe remedy, a mainstream medicine. And then pharmaceutical chemistry arrived. And like most plant medicines, lemon balm was quietly set aside. Not disproven, not replaced by something better. Simply deprioritized in favor of patentable compounds. It took until the 21st century for researchers to ask the question that should have been asked in 1950. Why did this work? What was actually happening? So why does it work? What is lemon balm actually doing inside the human nervous system? The answer starts with something called GABA-gamma-aminobutyric acid. GABA is your brain's primary inhibitory neurotransmitter. Think of it as the brain's natural brake system. When you feel calm, focused, and able to sleep, GABA is doing its job. When you feel anxious, wired, and unable to switch off, GABA is underperforming. Most pharmaceutical anxiety medications, benzodiazepines like Valium and Xanax, work by enhancing GABA activity. They're effective. They're also highly addictive, produce dependency within weeks, and carry significant withdrawal risks. Lemon balm contains a compound called rosmarinic acid. And rosmarinic acid inhibits the enzyme that breaks down GABA in the brain, meaning more GABA stays active for longer. It's essentially doing what pharmaceutical anxiolytics do, through a gentler, less direct mechanism. A 2014 study published in Nutrients found that participants who took lemon balm extract for 15 days reported a 33% reduction in anxiety symptoms and a 42% reduction in insomnia compared to placebo. No dependency, no withdrawal, no side effects beyond mild digestive discomfort in a small number of participants. A 2021 systematic review analyzed 12 randomized controlled trials involving lemon balm. The conclusion: consistent, statistically significant reductions in anxiety across multiple populations. Particularly effective for what researchers called subclinical anxiety, the chronic, low-grade anxiety that millions of people live with daily without a formal diagnosis. And here's the detail that never makes it into mainstream coverage. Lemon balm also reduces cortisol, the body's primary stress hormone. A 2022 study measured cortisol levels in participants before and after lemon balm supplementation. Average reduction, 28% over 4 weeks. Cortisol drives inflammation, disrupts sleep, impairs memory, and contributes to cardiovascular disease. Reducing it by 28% through a common garden herb is not a small thing. The monks didn't know any of this. They knew the outcome. We now know the mechanism, and they match. Now the practical part. Because historical knowledge and clinical evidence are only useful if you know what to actually do with them. Lemon balm is available in 4 forms: fresh or dried herb for tea, standardized extract capsules, tincture, and essential oil. Each has different applications and different evidence behind it. For anxiety and stress, the most clinically studied form is standardized extract capsules, typically 300-600 milligrams, taken twice daily. This is the form used in most of the randomized controlled trials. If you want the evidence-backed approach, this is it. For sleep, dried herb tea is the traditional preparation and the one with the longest historical record. 1 to 2 teaspoons of dried lemon balm steeped in hot water for 10 minutes, taken 30 to 45 minutes before sleep. The medieval preparation was essentially the same, with the addition of other calming herbs, particularly valerian, which we'll cover in a future video. For acute stress, a difficult meeting, a social situation that triggers anxiety, tincture form acts fastest. 20 to 40 drops in water. Effects typically felt within 20 to 30 minutes. Medieval healers used a similar rapid-acting preparation for what they called sudden frights, acute anxiety triggered by specific events. A few important notes. Lemon balm is generally considered safe for most adults. It can interact with thyroid medications and sedative drugs. If you're on either, consult a doctor before using. It's not a replacement for clinical treatment of anxiety disorders. It's a tool, one that 1,000 years of use and a growing body of clinical research suggests is a genuinely effective one. The monks who first documented its effects were careful observers. They noted what worked, what didn't, and what conditions produced the best outcomes. We're doing the same thing, just with better equipment. Step back for a moment and consider what this actually means. A monk in 9th century Germany, with no understanding of neurotransmitters, no access to clinical trials, no concept of cortisol, observed something, recorded it carefully, and was correct. Not approximately correct, not directionally correct. Clinically, mechanistically, measurably correct. This is not an isolated case. We've seen the same pattern with willow bark and aspirin, with garlic and antibiotic resistance, with honey and wound healing. Across centuries and cultures, careful human observation arrived at the same conclusions that controlled clinical trials are reaching today. What does that tell us? It tells us that empirical observation, the kind done slowly, over generations, by people paying close attention to what actually happened, is a legitimate form of scientific inquiry. It's just slow science. Very, very slow science. And it raises an uncomfortable question. How many other remedies are sitting in those manuscripts, waiting for a researcher to ask the right question? How many compounds are growing in gardens right now that we haven't looked at carefully because there's no profit incentive to study them? This channel exists to ask those questions and to go find the answers. Next week, we're going back to that same 9th century monastery, because the monk who prescribed lemon balm for anxiety wrote about a second remedy in the same journal entry, one he considered even more powerful, for what he called the affliction of restless nights, what we call insomnia. I'll tell you now, it's not valerian. You've heard of valerian. This is something most people have never heard of, and the clinical evidence around it is extraordinary. If you want to be there when we open that chapter, subscribe. Every week, one remedy, fully researched, fully explained. And leave a comment below. What condition do you want us to look for the ancient remedy for? I read every one. Many of our future videos come directly from these requests. The knowledge was never lost. It was just waiting. I'll see you next week.